are live. I want to welcome those who are viewing to the Necessity of Trauma Recovery Facilities. And tonight we are going to be talking about recidivism and mental illness with my guests, Deputy Raiford, Dr. Maria, and Pastor Sheldon Harris. And so I'm so grateful to have you all here tonight. And what I will do is I will have you all introduce yourselves, and then we're going to dive into the conversation. And so let's start with Pastor Sheldon, if you can introduce yourself.
I think he's on mute.
Oh,
I think so.
There we go. Okay. Sorry about that. No, I'm excited to be here. I'm excited for the conversation. It's a much needed conversation. I'm Sheldon Harris. I am currently in Tampa, Florida. I recently moved here from Columbus, Ohio in August. And I was a police officer for 5 years. And I stopped being a police officer late August. And now I am a senior leader here at Cairo, Tampa. I'm planning a church. So I'm excited about that.
awesome.
I'm here.
Nice. Dr. Maria.
Yes, good evening, everyone. And thank you so much, Brittany, for having me this evening, and to my fellow panelists. I'm super excited. I always say I never take these opportunities for granted. I'm truly humbled to be here. So again, I'm Dr. Maria. Maria Houston. I am the only one freezing in Columbus, Ohio right now. That's okay. Born and raised, a product of Columbus City School. So proud to say that. But I did obtain my doctorate in psychology from Wright State University. So I've been practicing about 8 years now. And so I've worked in a variety of forensic and community-based settings. And currently, I'm a proud owner of my own private practice where I solely see adults and sort of adolescents and those that are transitioning. So again, I'm excited to be here. Thank you.
Awesome. Thank you. And we're going to have Deputy Raiford introduce herself.
Good evening, everyone. I'm excited to be here as well and to participate in this conversation. I have been working for Arlington County Detention Facility. This year will make it 5 years. And I enjoy what I do and look forward to have this discussion with you all.
Thank you. Awesome. So once again, tonight we are talking about recidivism and mental illness. And I'm just going to cover the basics of what those two definitions are. And so the first thing I will do is start out with what recidivism actually is. So according to Webster, recidivism is the tendency of a convicted criminal to reoffend. When we look at mental illness, there are spectrums of definitions, but this is the definition that I'll give according to the American Psychological Association. And it states mental illnesses are health conditions involving changes in emotion, thinking, or behavior. Mental illnesses are associated with distress and on problems functioning in social work or family activities. So some time ago, I had to do a paper. I'll tell you guys how this topic came about, and then we'll kind of dive in. I had to do a paper. And this is one of the topics that I decided to talk about, which was the connection between recidivism and co-occurring mental illness, and how those who end up back into prisons or jails have some form of a mental illness or needs that mental health attention. And so I want to kind of dive into what you all believe to be that connecting factor between recidivism, so those who are either reoffend or those who end up back into the system, and mental illness as well. So I'll start with Dr. Maria. I'll let you go first.
I knew it. No, that's okay. So I think I'll just give a little context. So when Brittany and I were kind of talking about this opportunity, I think she was kind of aware of my background, but not some of the details. And so I think later on in some of our conversations, I shared with her my dissertation topic. was in fact looking at reentry issues for African American males back into the community after having been incarcerated. And so looking at sort of reentry issues is almost kind of like a backdoor way at kind of assessing recidivism. And because I wanted to understand why, particularly, young men and women of color were not being successful in the community. And so kind of what I found from my research and just kind of in doing the work. So I've been in institutions, correctional facilities in here in Ohio, also in Chicago and Wisconsin. They say if you go out, and I worked at Cook County. They say if you could work at Cook County, you could work anywhere in the world. So, so I think I'm good. But there was really a common theme or thread, if you will, that came up with a lot of these individuals, and it was issues of poverty and finances and employment. So those were a lot of things that sort of kept them cycling through that system. But then when you kind of couple that with mental illness, oftentimes, again, in communities of color, it's not one of those things where we're knocking down doors to get treatment. Oftentimes, people are self-medicating, right? So they're developing these addictions. I've worked with, juvenile delinquents as early as 11, 12 years old who've told me they've tried every drug that there is. I said, I didn't know that it existed. And I'm much older than you. And so they're almost kind of, and I do believe parents and guardians are doing the very best that they can. But oftentimes they're, raising themselves, trying to figure it out. And so those mental health conditions really go untreated. And so you couple that with the lack of treatment or resources, and people are just trying to figure it out. And so then they find themselves in those correctional settings because our system, because I'm going to say it, they've really done a disservice to our communities because they removed a lot of those community supports. And so I don't know the exact numbers, but there's a large amount of juveniles and adults that are currently in prison for drug problems. And those are not, that's just quite frankly not the place that they should be. But I'm going to stop and let my panelists jump in here because I know they got some good stuff.
Yeah, absolutely. Pastor Sheldon or WA, either one of you could go.
No, I was just going to say, I think you're absolutely right, Dr. Maria, that it's overlooked so much. And from me being a police officer, I've seen it a lot, especially with the juveniles, just that cycle over and over and over again. They're in, they're out, they're in, they're out. And, even in law enforcement, we wonder what in the world is happening. We can only do so much. But as we take them somewhere, we're expecting a program, we're expecting some teaching, we're expecting some resources for them outside of a brochure, but really a hands-on approach to it. And they're not getting what they need. And so they keep going through the cycle, and it doesn't help either that they don't have the peer assistance or the parental assistance that they need in those communities. So you're getting a lot of the mental illness, you're getting a lot of the drugs. And I think sometimes in law enforcement, because of the lack of training in it, sometimes we don't know the difference. And so we think everybody's on drugs when in reality, it's not the drug that you're talking to, it's the psyche that you're trying to deal with. And the training is at a minimum, just because law enforcement is so understaffed already. You try to make time for it, but I think that it definitely needs to be something that is talked about more to develop a better system to be able to handle it so we can reduce the recidivism that's happening right now.
Absolutely. I'm going to hit on that a little bit later because both of you made a really great point. I'll let Adrienne go as well.
Sure. To add to Mr. Sheldon and Dr. Marie, in our facility, we do have a mental health unit available to those who qualify, because they go through a entry process and are asked various questions and to figure out what level of like psyche that they're on to be able to qualify to enter into the mental health unit. And so we do have psychologists on staff through our health department. But in my experience, I've noticed that even with the help that they get, that we are still not fully equipped to handle like the different things that they are experiencing with the mental health illness, because they also have, not all, but some will have other addictions to mask the mental health addiction. So some people will come in, as they've spoken before, with the drug addictions. And so to cover and to cope with the mental health illnesses, some are aware of the mental health illness, some being undiagnosed are not sure what's going on, but know, like, okay, I know I have a problem, but I don't know exactly what it is. And so I truly believe, just from so many experiences working in that unit, that a correction facility, where I'm at, detention facility or prison, is not a place for them. They need to be in a place that can fully assist with their needs. I don't know if you're going to touch on this a little bit later, but we do have a partnership with a mental health institution, but a lot of times it's only court ordered and not readily available for someone to be sent there.
Yeah, Deputy, I think you make some really great points, because a lot of the individuals that go into these prisons who may, are aware of their mental health conditions, that sometimes they'll downplay them because they don't want to be vulnerable.
Yeah.
Because,
Right,
if you're
exactly.
seen taking psychotropic medications, or, you got to go to the counselor. So now that makes you vulnerable in a really tough environment. So they may have been, getting some treatment out in the community, but once they get into those institutions, they sort of let that stuff go by the wayside. And then, and you also kind of mentioned, once they are released, again, I just found, like, in the research and just working with them, that usually they're not trying to go to that counseling appointment. They're really just trying to find out where they're going to live, or where they're going to work, because that oftentimes that person that said, yeah, you can come live with me once you get out, they might give them 24 to 36 hours. And then after that, they got to figure it out. But yet they've been removed from society for however long, and so their priorities shift. It's not me trying to get back on my medication or see this counselor, but I got to eat.
Yeah.
Yeah. Or find somewhere to live, as
Yeah.
you just said. Yeah. And I'm sorry, I don't want to jump ahead, but just to add to what Dr. Maria was saying, some, not all, but some are homeless. And so, and trying to find somewhere to eat. And that's another reason why we say repeat offenders, but recidivism, because they're trying to figure it out. And okay, I gotta find a way to eat. So the person ends up committing a trespassing crime because they're homeless. They don't have anywhere to go. And then they're coming right back. They already know, like, okay, I know I'm going to go back. Especially when it's cold, they'll do whatever to get back in to the facility, because their food is provided, clothing, certain things are provided for them, even the medications, whether they want them or not. And some do downplay their taking medications, feeling vulnerable. Thankfully, in our facility, no attacks, have been on people that have mental illnesses, but I they have specified, not specified, but they have expressed, some have expressed fear of, if I take this, because people, they talk,
Yes.
and to one another. And so someone will end up finding out, okay, this person is taking this kind of medication, he's vulnerable, we can attack him, and whatever. So that is true with what Dr. Marie was saying about
Yeah.
mental
Or they
health
want to take
as
their
well.
medication so they can get high while they're in there.
And then too, exactly, and then too, they'll take it and they'll sell it to someone that person wants to get high, or that person has an issue that they haven't spoken about, and like they'll pass it on to them. They sell it for all kinds of things, a barter. I'll give you this for this, I'll give you that for that type of situation. So
Yeah.
it's it goes on.
Yeah.
Yeah, I think as far as like you all had mentioned, like the poverty, the homelessness, I think that those are one of the biggest things that keep them. It creates a really hard transition back into the world, and having to kind of fend for themselves and figure things out. And so I think that within that system, and then kind of that bridge between those that are mental health professionals, not necessarily depending on where you are, like Deputy Raiford, they have something there, kind of a part of it, but not so much as transitioning into, so that they can also have that assistance when they're out, and also seeking housing, and seeking financial stability, or seeking employment even. And so I think those are one of the top things that are probably the most difficult in the transitioning process. I do want to ask for Pastor Sheldon, because I know that there are some law enforcement where they've partnered with mental health professionals, so that they're able to be trained to see when this is someone that is just doing something that they're not supposed to be doing, or if it's a serious problem as far as seeking that type of mental health that they need, so that they can be, get diagnosed, or whatever the case may be. And so I know in certain states they have that. I'm not sure if they have that in Columbus. But what are some things that you've experienced with that, in differentiating between someone just doing what they're not supposed to be doing, or someone that genuinely has a mental illness?
Yeah. We do have some facilities they lack during third shift hours. There is also a facility I found for those who do not have a home called Star House. I believe they're connected with Ohio State. I think the only problem we ran into there in law enforcement working third shift is that they had no social worker available during third shift hours. So we got called there a lot because people were having mental issues or mental breakdowns. And then we would try to take them to a facility that was available, or a facility that would take them, or a facility that wasn't already full. Because a lot of facilities we would reach out and they're like, I'm sorry, we just don't have any space available for anyone. And you end up feeling bad because you don't know what to do with them. You don't know where to take them. And they're already hurt enough that they're homeless. They don't have anywhere to go. And then you try to take them somewhere and they're like, well, I'm worthless. Most of them become suicidal. And it becomes just a whole nother issue. There's definitely a need for more resources at all hours through the night. Second shift, first shift, and third shift. They're all needed, because sometimes as police officers out on the streets, we get our hands tied and we want to help, but then we can't. And if the person's an adult and we're getting calls of shootings and stabbings and stuff like that we have to take, we don't really know what to do at that time.
Yeah. Yeah. So we have a question, so I'm gonna I'll read the question and let you all answer, because I want there to be interaction too as well. So
I love questions though.
So this is Apostle Paula Cole, who is also in the mental health field, and so she asked, do you think that there is a need for more collaborations between the prison system and local community mental health agencies that have case managers in order to assist with the recidivism and the transition issues? So that's one part of it. So I'll stop there. Yeah, anyone can answer. I'll let you go ahead.
YES.
Exactly. Yes, yes, and yes. I will say, with our partnership with the mental health hospital, that once they are released into their care, it depends. Like I said, being that it's court order, it depends how long they have to stay there. But in staying there, they are in a place that they get all the help that they need, all the resources are there. The medication, the psychiatrists, psychologists are there for them to speak to as well. And the lawyers, they stay in touch with them as well. So I say yes, 100%, because a lot of times once they finish their program at that hospital, a lot of times whatever that they were charged with and whatever time that's given to them, depending on how they work it out in the courts, then they can go on and be ushered back into society in a, how can I say, adjustable way. But like I said, it doesn't always happen for each mental health person. So I would say yes, we would need more of it so that everybody that is dealing with the mental health um, situational issues can be available to them, not just some people. Yeah.
I agree with Deputy Raiford. If in an ideal world, if I ruled the world, not only with those individuals who were on a mental health caseload within the institutions would be linked with services in the community, I would absolutely have everyone leaving the institution being linked, at least for an evaluation, because I have not been an inmate in an institution, but I have worked in prison for about 6 years. And, you know, that level of restriction, stripping of, your freedom, and now for some leaving with, a felony and the limitations that proposes, it's tough, right? There's a level of trauma that is experienced when someone goes to prison. Yeah. On some level, and so I think that one of the ways we could potentially bridge the gap is to have, I think, like Deputy Raiford mentioned, those institutions in which that they would sort of be linked with were also in those institutions. So it was almost like you can see my face, whether it's that last 30 days, 60 days that you're going to be here. And then so when you land on, Livingston, right, you can see a familiar face. You can feel a little more comfortable because really, I mean, not only within the forensic and correctional settings, it's culture wide that we have to really make a shift in normalizing mental health, good mental health, and making it okay. And so I think particularly for that special population, we should absolutely be making it part of the norm, that, hey, would you want to talk about being, removed from your children, your family, your life? Just my 2 cents.
Yeah. I think there is another level of trauma when you are placed in prison and having to go through you're in a whole nother system and level in which you're kind of succumb to the things that are going on in your environment. And so I think that from just the trauma of having to go to prison and then just being in there and all of those experiences are like multi-level levels of trauma that someone has to experience and deal with. And I think that there needs to be more in place as far as bridging the gap. I think that there should be, whether it's transitional housing or something like Love and Light, which is what we're planning to do, is having housing and having where you're being seen, you're being treated, you're getting trained, you're getting assistance in some type of employment or some type of trade training or something, so that you can be an addition to society, but not only that, but so that you can be effective and heal. And so a lot of these people, they really just need a great level of healing. So Pastor Sheldon, did you want to add to that as far as just the prison system and the collaboration between like the mental health agencies?
I think that'd be a great idea. I completely agree with that. That would be awesome if that would happen. I think it's necessary because that's where the cycle is. And I think to break that cycle, you need to put that in there because, like Dr. Mary was saying, you're going to be able to see the same faces. And not only that, but you get to develop a relationship with the community that way. I completely agree.
Yeah. And so some of the strategies, I think, as far as bridging that gap, of course, we said maybe having more transitional housing, having kind of that collaboration with the system and mental health professionals, and kind of, as Dr. Maria said, being along that journey in their transition back into the world, and so that when they do leave and they're able to see a familiar face as well. Here's a question. Why do you think that there are, well, I know the answer, but I want to ask this just for conversation's sake. Why do you think that there are higher levels of people of color who are in this cycle of prison to recidivism to the mental illness, or just the two without the mental illness? Like, what do you think about that?
We don't have enough time.
Right.
I say, woo, I'm telling you.
There's so many
This whole
levels,
conversation took a shift.
I tell you. Oh man.
Well,
do you want to go first, or Dr. Maria, whoever?
I've always been, unapologetically, Black, right? Proud of my Blackness. But I wouldn't say I was one of those individuals that like knew a lot of my history, that kind of was really indulged in it. And actually this pandemic has sort of provided that for me, where I've spent a little bit more time looking at, our history. And kind of understanding things from a different perspective. And so you asked the question as to why we're so disproportionately represented in those prison systems. You take it back to history. We were freed as slaves, but we really weren't free. And so, I mean, we can kind of go on and on, we're just so at a disadvantage. And I truly believe, again, we, as a people, as a culture, have tried to do our very best. But we're fighting things, like institutionalized racism, internalized racism. I had some classmates who, looked at colorism. Like I said, before that, I knew nothing. Like, what do you mean colorism? I'm just Black, you're Black. But, there's a whole history line of, levels of racism where it's not as overt, right? But it's that you don't get that bank loan, or, you don't get that job or promotion enough to where you can support your family. So then you resort to other things. And so there's so many things, but and it's like, people are like, oh, you can't hold on to slavery and things like that. Why can't I? My grandmother, rest her soul, passed in November 2020, and she was young. She was 72, but she grew up in Alabama and picked cotton. So that's not too far removed. So there's a lot of things where we're kind of working from behind, and we need a lot of support.
Yeah.
So we fall victim to those systems, unfortunately.
It makes me think about, you go to the doctor and they ask you, what is your family history, to kind of help with the diagnosis. Do you have heart disease? Does that run in the family? Does diabetes run in the family? Does this run in the family? Does that run in the family? To help them narrow down through a process of elimination what they can diagnose you with. I think, our brain is an organ, and there is, I'm no doctor by any means, but I believe that there is a generational trauma of unresolved issues that we as a Black community even need healed from, need attention for it to kind of help. I mean, gentrification, redlining, systemic racism, all these things, and more are still happening. And although, we're not being hung, and although not happening how it looked before, it's happening in a more subtle way. It's just as damaging. It's just as conniving. As it's more crafty. That's it. It's still it's still happening, and I think that needs the attention. The conversation needs to be had. And I think we need to do better at having that conversation and not allowing the media to be our volume. The media stops talking, and so do we. And I think that's the problem. We need to have this consistent conversation, and not just have a conversation, but I think really come together and develop a strategy as to how we can help reduce all of these things.
Yeah, that's good. Adrienne?
Well, wow. Both of my panelists have spoken very well about the reason why. I just would like to highlight a part of it, and part of it in poverty. I've talked to a lot of inmates as they go to and fro, in and out, and a lot of them have spoken about just living in poverty and not having access to certain resources, so they resort to doing crime to get what they say they need. And going back to the history, being targeted more so than our other counterparts, that has something to do with it as well. But resorting to breaking the law or committing a crime just to get things that they need is what they see as how can I say, like, just trying to make it or get by, because they live in poverty and not having the education, not having parental support, community support. They feel like, hey, this is much better because I get the fast money, I get this, whereas I'm working at a job that I only make $15 an hour. Where am I going to live? How am I going to feed my family with this amount of money? And the cycle continues. So just like both of Mr. Sheldon and Dr. Marie said, I just want to kind of just to lift it up, because it definitely has to do with history all the way through. But for sure, that's one of many reasons why.
Yeah, I think as far as like, even if we put aside like the mental health part of it, just with the history of like pipelining as well, and just all of that on top of just, I don't know if I want to say this, but just the crack when that era was going on, and all of these different things that kind of have led to high imprisonments among the Black and brown populations. I think that's something to really take into account too, just even outside of the mental health side of it. But there are billions of people in prison now just for like petty crimes, and and so that's something that we should definitely look at, as far as, like you all stated, like the history of who we are and where we've come from, and the different things that we haven't had access to and are now learning, and things like that. And so I think that we should definitely highlight those things as well. What do you think are some interventions that we can put in place to reach those who are transitioning from that to then the world?
Yeah. One thing I do want to add, I think part of that question was, why are Black people so disproportionately represented in jails? But I think there was also maybe a mental health piece to that. And I guess I just like to kind of say that, people of color are not, they don't present with more mental illness than their counterparts. Right. And really the research is really screwed, or it's inaccurate. Skewed. Thank you. I was like, wait. But don't you just love life? But we're people too. But because we're not oftentimes represented in those numbers. And we're not, seeking those treatments. So, but I don't believe that we, and I include myself as, community of color, have more mental illness than any other ethnic communities. But as far as interventions, I think I mentioned it earlier, and I'll kind of say it again. It really has to be a culture shift. We really have to start to normalize it in our homes, in our churches, in our school, in our workplace. We shouldn't wait till a pandemic hits to say, I think I might go talk to someone. I've said this in other discussions where the pandemic has almost exposed a lot of people. Right, in terms of their abilities to cope with things. A lot of their distractions that they've used were sort of stripped from them, and they were almost forced to sit with themselves. And so I think this should be a great opportunity for us to understand the importance of having a healthy mindset and to address any mental health issues, because mental illness is a spectrum. I'm sure, and maybe I'll just speak for myself, at some point in time in your life, you've probably met criteria for major depressive disorder. You may have been anxious at one point where it interfered with your ability to perform well. And so we shouldn't be ashamed of that, and we shouldn't be, deemed less than for it. My passion really comes a lot of times, and really why I got into this is because I had a great aunt who actually committed suicide because she was suffering in silence. And so I really don't want that to be the case for anyone ever, because we don't have as many resources as we need, but we have some, right? And it's going to take all of the communities to, again, kind of buy into this idea that it's so important for everyone, even someone that may have committed a crime. They still deserve, to be provided with things to treat their mental health. So I know I went on a tangent. So
You're good.
Well, that's really good. You mentioned the pandemic and exposure. When I was an officer, we started to experience a lot of homicides with teenagers. 13, 14, 15 years old. We were getting them week after week after week. And we were like, what in the world is going on? And it was all in our community. So I was talking to a kid one day who was a witness to a homicide. And I'm like, what's going on? What's happening? Is there beef? Is it gangs? And he said, you know what? Honestly, we don't know what to do. This pandemic is we don't understand. Like, we can't play basketball anymore. We can't. Like, it's a traumatic moment that I think that, we don't realize even what it's doing to our kids. What I believe later in life, we'll start seeing some manifestations of some pandemic trauma that we overlooked in the moment because we didn't think anything of it. But our children and even adults don't really even know how to handle it. Like you were saying, they have to sit with it and don't know how to deal or compartmentalize what they're sitting with. And so what happens? It turns into drugs because they don't know how else to cope, and it just messes them up for later. Next thing you know, they're in jail, and then they begin a cycle.
Yep.
It's sad.
I know a lot.
Yeah, and to add, oh,
Oh no, I was just going to say, I'm sure the domestic
sorry.
violence numbers went up.
Yeah.
I was getting ready to speak on that. I was going to say, I was going to say to add on to, right, exactly, to add on to what you were saying. During this pandemic, we have seen an increase of domestic violence, um, um, of people coming into our facility, into the jail, and both men and women beating on one another. And so having to sit with each other, being in the same house now, that they can't ignore one another. They can't say like their different shifts or anything that, or just go to whatever they were going to or doing to avoid one another. Now they have to sit with each other in the same house and then realize certain things about themselves and about one another. And so the domestic rate increasing, and I have noticed it's not it's more women that were being brought in for domestic issues at the home. But same way, both men and women. But either way, that's when we notice like, wow, this is really affecting people in a way that we hadn't seen before. We see people coming for all kinds of crimes, but not just as far as like rate of domestic violence. You're just like, wow, like people really have to deal with one another now, and really, you know, find out whether like, okay, I don't know, whatever the issue is, just not working well together. So I definitely would say with the pandemic, exposure amongst people living with one another has been on the rise. And as far as intervention, uh, as, as they both have spoken on, having getting things in place as far as having a place of like love and light in the community. And also I would say partnering not only with the jail facility but also with churches, just anywhere in the community that it could be available, that people can go to and get help that they need and feel safe. I would definitely um, agree with that.
Yeah, I found that just from looking at like different rates and everything, that the rates of like domestic violence and just the amount of calls to the suicide prevention line, and just the texting share and all of that, that the rates of all of those have gone up just with the effects of the pandemic, of being home and of being isolated and not being able to be around either people or being around their abuser in the home. And so with that, and then as well as children having to face that a daily, has definitely been a surge in those numbers. And so I did want to kind of hit on those experiences as far as you all have had with those who have kind of dealt with I don't want to say pipeline, but those who have kind of dealt with mental illness or just a mental health issue, and the effects of it. And so we can kind of hit on that a little bit as far as how that affects their life with other people, and with due to their environment as well. So I know, Pastor Sheldon, you have as being a police officer prior, you had mentioned about just the differences in knowing whether you're speaking to someone if they're high on drugs or something, or speaking to their psyche. Can you kind of explain that, what you mean by that, to those that would like to know?
So in law enforcement, you're dealing with a lot of different people, and depending on where you're working, you might be dealing with, a lot more crack in one area, a lot more cocaine in another area, meth in another area. When you're dealing with people who are on drugs constantly, they can't make rational decisions. They have outbursts. They have manifestations that are very similar to mental illnesses at times. and sometimes they can be overlooked, or sometimes you think someone may be struggling in their mind and they're on drugs. They're on drugs, and you know, and so I think again it goes back to the teaching and the training that law enforcement get. Like Deputy Raiford said, that like, and even the Columbus Police have the CIT, and we go through some training there to determine, not really even to determine the mental illness, but how do you help them? Because depending on what they're struggling with will determine how you help them. But that is not, or at least when I was in, it was not a mandatory thing for officers to go through. It was a choice, and I think they just now made it mandatory. So we had a lot of, we had a lot of officers that didn't understand, and we would call for a CIT officer, but if the CIT officer was tied up, you were left doing anything you could to try to handle that situation without escalating the situation. It required a lot of patience, but lacking the knowledge is where officers fall short when it comes down to mental illness. So I think I'm glad, at least in Columbus, Ohio, they now made it mandatory that you are CIT certified. That's very, very helpful because then too you're like, okay, I know what this is and I know how to handle it, and it just makes the whole process. It really reduces use of force. It helps you to know how to communicate. It helps you to know this isn't a situation where you need to get too close too fast. This is a situation where you don't need to raise your voice. You need to lower your, you know. Um, so the teaching, I think, is necessary in law enforcement. And then, too, the resources that the law enforcement gets so that we know where to take them to that is going to be most beneficial, rather than just saying, well, you know what, you're going to jail because you haven't been trained enough to know. So now, because there's no training, we actually end up helping the cycle by throwing them in jail. And then, and so I think having the resources and having the training at the law enforcement level will give us the education enough to know how to handle the situation and have the resources enough to send them to the right place and the right person.
Yeah. I as I was doing some research, I was seeing how some states, I don't know if it's all states now that require the CRT training or not, but there were only a handful of states that I had seen. So I don't know how accurate that is right now, but where they were trained, when to, lower your voice and when to kind of be patient and being able to discern or decipher at that point where they needed to go. And I think that is necessary so that we're putting them in a place where not so much as so that they'll also be safe, but then so that they're, like you stated, they're being treated for the right things and they're being seen, so that they're not being thrown into a place where they're not given effective treatment as well. So Deputy Raiford, did you want to add to that? Because I know that you also kind of have seen and have dealt with those that come in and kind of get that as well.
Yeah, I could add to that. I would say that for those who are brought in, they would get help through the magistrate, seeing that depending on what state they're in, if it's visible and they are experiencing, in the moment of, how can I say it, sometimes a manic moment, or they haven't had their meds or off their meds, and they are, just dealing with whatever they're dealing with in their mental illness, the magistrate will issue an emergency placement called an ECL, and that's when they're taken to the hospital, where the hospital will have they have a small section for mental health inmates or patients. The only issue with that is just having the room to place them, and a lot of times there's a very long wait just to place them in that mental health section of the hospital, and it's not a very big place, and they're only there for a short period of time because it's an emergency placement and not like a temporary, because sometimes it will transfer over to a temporary placement called a TDO, and that's when they'll probably get like 30 days to stay in that place if there's a space. So that's where the issue comes in, because if there's no space, then they may have to return back to the jail or try to work with the lawyers, if they have a lawyer, to get a court order to take them to our partnership mental health hospital. So I would say that just more needs to be done so that they can get the help that they need immediately, instead of like I said, a lot of times they come straight to the jail, and then, when seen by the magistrate, they'll determine whether they need to get that emergency placement or not. But a lot of times, again, it's not visible. Like they may not be having a mental, but they do have a mental illness, and still that's when they really won't get the help that they need. So our state in Virginia, we are required to have the CIT training, and it has been helpful, but still, it has been helpful, but we still need more resources and the knowledge and how to help them.
Yeah. I will add to this as far as law enforcement is concerned. The training that we get for that is for how we're to respond to them.
Right.
But I believe that law enforcement needs it for themselves too.
Most helpful.
The trauma that law enforcement deals with is traumatic in itself. And I think it goes both ways. I think that when you're asking a wounded officer psychologically to help someone else who's wounded psychologically, that's when use of force starts going up, because the police officer doesn't even have the mental ability to even have that kind of patience. I think that may be a whole nother conversation as far as mental illness is concerned, and the help that is needed for people. It's even in the law enforcement. And the fact that the law enforcement deals with those who have mental illness and deal with mental illness themselves, but that gets overlooked because we've not normalized mental illness. And so a police officer is a coward, or whatever you want to call them, if they go and say, look, I'm struggling in my mind. It's like, look, pull up, tighten your bootstraps, get up and go to work.
Mm-hmm.
That's a mentality we got to get away from so that we can get the help that we need. If we're actually going to be effective in the community.
Yeah, that's so good.
Can I add to that? So, in the Commonwealth of Virginia, where I'm working, I will say that we do have what we call EAP. So a place where as employees can go and talk to psychologists, psychiatrists, those to help us with whatever we're dealing with the job, with life, because you know how that is with life, and it kind of overflows into the job, and especially dealing with all that we have to deal with and face. But not everyone utilizes what is offered, even though it's confidential, it's supposed to be confidential and things like that. But some had that stigma, like you said, I'm just gonna just go with it and not deal with our own issues and not be seen. I don't want to be seen going into that building. I don't want to be seen talking to someone to get the help that's readily available for us.
Yeah. And I was a part of the peer assistance team with the Columbus Police. So again, it's confidential. You're on a list, and people have the opportunity to contact you, or if an officer is involved in a critical incident, we'll send some peer assistance team to them. But it would be nice to see law enforcement officers go through a traumatic incident, and then it be mandatory that they go through some counseling. Because I had a situation the other day where the peer assistance team was sent on an incident where the lady ran next door to knock on the door because they were having a domestic issue. The husband was at home. The dispatcher asked, does he have any weapons? She said he didn't have a weapon on him, but there is a weapon in the house. And while she was at the next door, she heard a bunch of gunshots go off in her house. Officers had to force entry, and unfortunately, he had taken his own life, and as well as the children's lives. So that's very traumatic for the mother, but it's also traumatic for the officers that have to go in, and I think that's an opportunity right there for the mother to get as much assistance as she can, and the officers, get mandatory assistance in that moment too, because what ends up happening is these officers become passive about a situation that is actually traumatic for them, and they don't know how to deal with it. Then they get a couple weeks off, a couple of days off of work, and they go back to work impatient. They're ready to fight. They're freaking out. They can't sleep. Now they're consuming alcohol. Now they're consuming pain pills, and they're still working.
Oh yeah, still working.
So
Yep.
It's traumatic.
Yeah. And even just to add to that, the traumatic of deaths in the facilities is also a traumatic situation, whether experiencing it while it's happening or having it coming up upon a dead body, and then of course having to report that the same situation, the several days off, investigation, such and such, but they don't require them to see anybody. So I would add to that. Yeah.
Dr. Maria, did you want to add to that?
They've done a good job. The only thing I would just add is I completely agree, especially when we're in a helping field. And I think sometimes we forget that officers are, in fact, in a helping role. And so it's really hard to pour in others from an empty cup.
Mm-hmm.
And so you're right, when we experience those traumas, whether it's on the job or in our personal lives, because we're not immune from experiencing life ourselves. Even me as a psychologist, I've experienced different things that impacted my mental health. So it's just so important for us as professionals to make sure that we're well. And again, as we've all kind of stated, that's how we begin that, narrative shift and making people know that it's okay. It's okay to get support and help it when you need it.
I think one of the things that would add, kind of like what you stated, is kind of normalizing it, breaking that stigma of mental health, so that those who are on the job or wherever they are, that they are seeking that support, as you all have clearly stated, seeking the support and the help that they need, so that they're able to, when they do, go back to their job or to their communities or to their families, so that they're coming back as their best selves, and going through that process of seeking that support, whether it's to a therapist or a psychiatrist or whomever, and kind of getting the support and help that they need. So I definitely see both ends of where the trauma happens for those that are out in the field or within prisons, and then those that are also traumatized with those that are going into prisons as well, and those repeat cycles. So I definitely agree. If you all could say, because we're going to close in a few minutes, but if you all could say like one thing that you think, if in your position right now, whether you are currently in enforcement or not, or I know Dr. Maria, you're still practicing. So if you could say at least one thing that you believe would help to reduce that cycle of recidivism in those who have co-occurring mental illnesses, what do you think would be probably the greatest impact to reduce those rates? I'll let you think on it for a second.
Okay.
Yeah.
I think I have mine.
Okay. We'll start with you, Dr. Maria. You go ahead.
Okay. So in addition to me doing private practice, I'm also inside of a juvenile facility. And oftentimes the behavioral health staff and the sort of correctional or administrative staff at times can sort of clash. And the reason being is that oftentimes our mission is slightly different. So from the administrative or correction side, safety and security. Everybody's just got to be safe, and that's it. From my seat, I want to start to provide other things such as emotional corrective experiences. I want to address traumas. I want to teach better coping skills. I want to provide treatment. I want to help to rehabilitate. So I guess my one thing, I think Pastor Sheldon kind of said this as well, but if we can just all remember that that population, whether it's juveniles or adults who are in prison who have, committed crimes and, may have recidivated, that they're still human and that our goal should always be rehabilitation. And so kind of keeping that perspective in mind, and that we want to restore them and keep them in the community. So treating them as such, treating them, because so I have a family member who's incarcerated, and they're not a bad person. I know that because I've known them all my life. They made a mistake. And so, but my hope is that professionals, especially, but then the communities will still continue to pour into him, and, coming back home and being successful. So, just remembering that they still are a part of our community, and that we really want to work towards restoration for them.
Awesome. Whoever wants to go next.
I think I have a few words actually.
Look like he's still thinking.
I know that was a lot of words.
I have a few. I would say support. They need support, and that I guess that would sum up all of what I would say. In resources and in training. So if they could get the support from their loved ones, also community support in programs, training in how to enter back into like a reentry program, coupled with I'm gonna say like mental health support. I think that would help most definitely to reduce recidivism and how can I say that? Recidivism and also like dealing with the mental health issues.
Awesome.
I would have to say this. First of all, Dr. Maria and Deputy Raiford, that was awesome. I'm going to kind of go a different route here. And I'm going to say, I think it would be good if we could be a little bit more proactive than reactive. And perhaps there could be a system in place where we can develop a demographic of where these people are coming from. And then once we determine where they're coming from, ask ourselves, I'm speaking about juveniles, ask ourselves, what is the education system like? Because I noticed that there's a lot of juveniles who don't really have the parental guidance that they need or whatever circumstance that they're in, who are in and out of jail, in and out of jail. And I was only a police officer for 5 years, but I had the opportunity to sit next to veteran officers who've been police officers for 25 years. And they see these kids go from the age of 14 to the age of 35, still doing the same exact thing, stealing cars, selling drugs, getting in shootings and guns and this and that. So I just wonder, it's just me just kind of talking out loud, if there is a proactive system that can be created based on a demographic, and even start getting into the education system to try to be a little bit more proactive in preventing even traumas, or when the trauma comes at a young age and they don't have the parental guidance to help them cope, help them to be able to cope in those situations. So maybe mandatory counseling and education system that will help these kids and the health of their mind to kind of prevent some of these cycles that have been going on. And so maybe instead of working backwards at a rehabilitation state, I think both and we can try to be a little bit more preventative with maybe a system in place for therapy at a level before it even happens, and how we can help them. I hope that makes sense. I'm kind of just talking out loud. Maybe there already is something like that. I don't know, but I just think at a juvenile or at a younger level, a system in place to help them with their mind and help them cope and help them deal with some of the things that maybe wasn't even something that they asked for at the age of 8, 9, 10. You know, when in kindergarten, we want to be astronauts and firemen and princesses. You know, that's our goal, right? But then nobody says I want to be a drug dealer. Nobody says I want to have experienced traumatic incidents and turn into a mental illness. And so I think if we can start at a young age, we might be able to fix a little bit of the problem as well.
Yeah, I think that's a big thing as far as even, like you said, looking at the educational system. Studies show that those that have familiar support excel in education and as far as getting that support from their educational institutions as well. So I think it's like what is the word I'm looking for? Like a domino effect in a sense, because those that do, excel educationally have that familiar support, but a lot of people that we see, especially these days, don't have that support or have they're in broken homes, and so there's so many different things that I believe we can look at from all spans to be effective and make an impact. So I want to say thank you guys so much. I don't want to keep you all longer. I know we can talk on and on. I don't want to keep you all longer than an hour in talking about this discussion, but I really appreciate you all for just agreeing to be on and for giving, your knowledge and your expertise on this topic. It just warms my heart. So I thank you all so much. Once again, everyone, we've had Deputy Raiford, Dr. Maria, and Pastor Sheldon talking with us tonight about recidivism and mental illness. This is the first part, and we will be having part 2, I believe, January 26th. And so once again, I thank you all so much. And for those that are on, please feel free to like, comment, and share. And we will see you all next time. And thank you guys again so much.
Thank you.